Bismillahirrahmanirrahim. Welcome everyone. This is our 11th webinar. Alhamdulillah, we have been so far resilient. At least we are fighting. And as you know, that Eid is around the corner, EIDUL Azha, and it has a lot of significance in terms of religion, but also it presents challenges during this pandemic. So on behalf of Shifa International Hospital and PGME office, I welcome everyone on this aspect of COVID-19 to talk about EIDUL Azha. और ये कोशिश हम ये करेंगे कि उर्दू में बोले तो अच्छा है, जहाँ पे इंग्लिश में बोलने की ज़रूरत है हम बोलेंगे, ठीक है? We will have about 20 minutes each to each presenter. And we will start with Professor Muhammad Iqbal Khan. Dr. Iqbal Khan is a professor of surgery, consultant general and vascular surgeon, Shifa International Hospital. He is the vice chancellor, Shifa Tameer-e-Millat University. And he is been our man in many issues. But I've asked him to talk about pandemic and religious obligation. So over to Dr. Iqbal.
Thank you very much, Professor Ejaz. Actually, you asked me to speak about the religious aspects of the coronavirus. Probably it is a little bit difficult for me because I'm not a religious scholar. You put me in a difficult situation. But anyway, I'm trying my level best. Whatever I know a little bit about the religion and its application in medicine, I'll try my level best to speak on that in my capacity. As you know, we all know that Eid is near, and there are other religious congregation is going. Inshallah, we expect in Muharram as well. We all know that coronavirus has actually changed our lifestyle and our community responsibility. And therefore, we have devised few more mechanisms how to go for prevention of this spread of this disease. As we know, there are few things where we can only prevent this disease, and there is no certain cure of this disease. This could be the social distances, hand hygiene, use of PPE, etc. But one of the major aspects of this prevention is the prevention of our crowding. When I'm talking about the Muslim Islamic aspect, it is equally good for everyone, not only for Muslims. It is good for everyone because our Rasulullah was sent by Allah subhanahu wa ta'ala not only for the Muslims. He has been sent down to the humanity. He is not only for the Muslims. And the second aspect of my assumption is the Quran says clearly that they are not created the human beings, all the human beings, not only the Muslims and the jinn, only for my worship. So, and the purpose of this worship is not to get some reward from Allah subhanahu wa ta'ala, from the people. It's clearly said in Quran, so we don't need any facilitation from you, and we don't need any rizq or anything to be fed. So and one thing which should be clear here, we all say that we need to fight with the with COVID. It's difficult to fight with the COVID. It will be more appropriate to say that how we can manage the COVID. Last one, Allah says, you won't be able to even imagine what are the forces of Allah subhanahu wa ta'ala and how they operate in this world. We won't be able to comprehend all those forces. And secondly, I just want to share with you the spiritual aspects and the worldview. The spiritual aspects of the pandemic is the first time in the history of Islam, history of the world. Rasulullah in his very famous hadith, it is quoted in Bukhari, it said that, and this hadith was displayed widely in Europe and America, everywhere, where Allah subhanahu wa ta'ala said, وَإِذَا سَمَّيْتُ بِطَاعُونَ بِأَرْضٍ فَلَا تَدْخُلُوهَا وَإِذَا فَقَهَا بِأَرْضٍ أَنْتُمْ مِنْهَا. So it is said that whenever you listen or when you hear about a pandemic, don't enter into that place. And if you are inhabitant of that place, don't come out of that place. And that gives you a very clear concept of current time. And why it is said? It is a very great responsibility on every Muslim. So being a Muslim, our responsibility is much more higher than those who don't believe in our. But why Allah subhanahu wa ta'ala is saying, Inna raddal asmawati wal ardi wal jibali wa bayna yakhmilna wa ashfaqna minha wa hamala al-insan innahu kana zaluman jahula. That we have certainly, indeed we offered, anything? We offered the trust to the heavens, to the earth, to the mountains, and but everyone, they declined. They actually declined and feared to bear this trust. Indeed, it was entrusted to Muhammad al-Insan, the human being, and therefore why it was entrusted and why he took this responsibility, because he was unjust and ignorant, and we should fight with the injustice and ignorance on the other hand. وَرَزَقْنَاكُم مِّنَ الطَّيِّبَاتِ فَضَّلْنَاكُمْ عَلَىٰ كَثِيرٍ مِّمَّنْ خَلَقْنَا. So it's very important that human being has been given the superiority over the other creations because of their nature of responsibility which has been given to them. And therefore, Allah subhanahu wa ta'ala has bestowed the human being with the knowledge. And it is said clearly in Surah Baqarah, قَالَ رَبُّكَ لِلْمَلَائِكَةِ إِنِّي جَاعِلٌ فِي الْأَرْضِ خَلِيفَةً قَالُوا أَتَجْعَلُ فِيهَا مَن يُفْسِدُ فِيهَا وَيَسْفِكُ الدِّمَاءَ وَنَحْنُ نُسَبِّحُ بِحَمْدِكَ. So when Allah subhanahu wa ta'ala wanted to create the human beings, and he asked the angels that I want to create another Khalifa. Khalifa means the person who is actually executing whatever is being said by the Lord. And so what did they say? What was their answer? They said, you will create them, they will create the fasad fil earth, that is the inequality in the earth. And they will be fighting with each other. And we are enough to pray you and do whatever in our capacity. So Allah subhanahu wa ta'ala said, what I'm going to create and what I'm going to do, you don't have knowledge of those things. And and therefore, it is our prime responsibility, being Muslim, that we should be we should create an atmosphere around us that should be more healthy, and we should protect our environment from all evil effects which can be detrimental for the well-being of our people. And therefore, Allah subhanahu wa ta'ala said, it's a very, very simple thing about the hand. Whenever you want to eat, or when you finish your eat or drink, you need to wash your hands. It should be compulsory for every Muslim. And another very important aspects of our life in the when we are living in the community is we need to remove all sort of harms. And it is said in Bukhari, Muslims, Mutafaq al-Hadith, I quoted it in Arabic as well as in English, and removing a harmful object from the road charity, a sadaqah in the Islamic way of life is the removing the harms which can cause harms to the another hadith which is also about our lifestyle is that al-mu'minu kabir khairun wa hubbu ilallah min al-mu'min. And therefore, our lifestyle should be of such a way that we should not be eating much, we should not be eating less. We should be having balance in our life. And that balance is being determined by various hadiths and Allah subhanahu wa ta'ala says, "Kulu washrabu wa la tusrifu." Eat and drink. Don't do israf. Israf means overzealous. Therefore, our eating habits, our dealing with the people, and our women are true Muslims. And the Sahih Hadith in Surah Al-Mu'min al-Kabir min al-Mu'min, and a stronger Muslim is better than a weak Muslim, and he's being loved by Allah subhanahu wa ta'ala as well. And this clearly says that the disease, a diseased person who is having some disease, it is a test of Allah subhanahu wa ta'ala, but at the same time, we should avoid infecting the disease for ourselves, for our near ones, and for our and our dietary practice. So it said in Quran that kulu washrabu la tusrifu, eat, drink, but don't do israf. So don't overeat. So there are so many other hadiths which says that we need to have healthy lifestyle. And we can sometimes learn about the lifestyle. And one important aspect of our lifestyle or the life of the Muslim doctor is ma anzala da'a illa anzala lahu shifa. Allah subhanahu wa ta'ala has not sent any disease, while he has not sent the cure of that disease there. If the non-Muslim person who doesn't believe, he doesn't have that responsibility as the Muslim doctor. If we don't know the cure of some disease or the treatment of some disease, it is our responsibility to find out that. And this is how we can find out. We're doing some research. So research is obligatory for every Muslim doctor. And then Allah subhanahu wa ta'ala, Rasul said, it is again a mutafiq alayhi hadith that we should not overeat and do not fill our tummy with the food only. And there is a famous hadith, and because of the time, I'm just going to touch upon that. And there is another hadith, so either we say the best things are the things are the good things, or we should remain silent. And out of all those Islamic teaching, the basic resources is the Quran and Sunnah. The ulama has come out with some principles. I'm not going to discuss this. There are hundreds of principles. Some of the important principles are do not harm to anyone, and do not inflict any harms to others, and do not harm should not be inflicted ourselves. We cannot inflict harm ourselves and to others. This is a very important principle, and I want all of you to understand this. This is very important. We can't inflict harm to ourselves, we can't damage our health, and we can't damage the health of other people. And the second principle is that danger must be eliminated at all costs. There is existing or impending danger that should be removed at all costs and at all times. And then another third very important aspects of the Muslim medical practitioner is the emergency situation allows all the previously prohibited things to be. So in a society where there is a requirement, it is the government can prohibit the allowances as well. So those things which are allowed in the normal situation can be prohibited, like the Friday prayer, like the Eid prayer, and so on and so forth. So they don't say that they have committed some sin. This is the principle of Hidayah, or principle of the Islamic way of life, that whenever it is required, we can suspend one or the other allowances for the community that cannot be allowed for a certain period. Then another very important aspect of our life should be that is the damage first before taking benefits. That is using we use the damage first before taking benefits. That means we should not be in Arabic called al-mufasid muqaddam la jabal al-misal. So that means that first we need to remove the damage and then think about any impending damage or anything which is which might cause damage to the people or to ourselves, that should be removed at our cost. And therefore, the ruling is do not harm to yourself and do not harm to the community, and your all actions should be. And very important aspects which is also derived from Quran and Sunnah is the no mother shall be treated unfairly on the account of the child, or the father should be treated on the account. It's a very important principle that anything anything which is unfair should not be implicated to anyone. And there are so many other principles that skip for time. It's very important that another very important principle is your personal or your local interest is overridden by the public interest. So this is another very important principle, and it is called Article 26 in the principle which says that our private interest, if we have an interest, we take two types of interest. Private interest is very important, but the public interest always override the private interest. And another very important principle is the repelling an evil is preferable to securing a benefit. So if the benefits is coming out, but it might cause it might cause a certain evil as well. So evil should be repelled rather than the seeking for. And very important is we always say is written on all the hospitals and everywhere, but we forget the first part of this ayah. Since Allah cares about the human life as well. So it is very important that those who kill someone without reasons. So reasons are described in Quran and Sunnah. What are those reasons? So if they have killed other people. So if someone dies because of our negligence, if our father at home dies because of our ill treatment with him, so we should be responsible for that. As if we have killed not only our father or our dear, or someone in our community, someone in our mosque, or someone living with us, but if we have killed the whole humanity, so it's very important that we should be coming. So the other important aspect is that the human history is facing the epidemic of this era, and it is very important that what are the guidelines of being given to cope with the with this. I just want to take you to a dialogue, very important dialogue between Hazrat Umar when he was Khalifa and his governor at Syria. His name was Abu Ubaidah. Interesting dialogue between when the plague erupted in Syria. Abu Ubaidah, Umar sent a message to him that Ubaidah come out of that place and come to Medina. So he refused to come, and then there's an interesting dialogue. And that's what if we have a time we can share this dialogue. It's a very interesting dialogue. said that Umar Amir al-Mu'mineen, I listened to Rasulullah sallallahu alaihi wasallam saying that whenever there is a ta'un or a plague or an epidemic, a certain place, don't come out of that place and don't into that place. And therefore, though I'm not going to come out, say he said again. So what happened, Abu Ubaidah, he actually shahada or martyred in Syria, but he didn't come out of there. Plague epidemic, 30,000 people probably died. Another Rawaya there, 70,000 people died. But if he had traveled from that place to Medina, probably all of Medina would have died because of that. And therefore, it is very important that the concept of quarantine is first time in the history of humanity was described by Rasulullah. And the other important principle is that is also a hadith in Sahih Bukhari, which says, do not place the sick patient with the healing patient. So we should be segregating the sick. Aspects of quarantine which has been described, and there are so many other hadiths which shows that we should be not be mixing the patients with the healthy people around. And out of all these things, I just want to share with you another hadith which directly one our principle of our life is when anyone amongst you wakes up from sleep, he should wash his hand first before putting his hand in the utensils. The very important principle which is being derived from this hadith is that the cleanliness, the tahur is a very important aspect of our life. And there are so many ayah of Quran, and I quoted some of those ayah. To our Prophet's lesson by Allah subhanahu wa ta'ala, clean your garments, and truly Allah loves those who keep themselves clean. And yes, and there is another ayah that which says that those who want to climb up to the best possible purification, they should keep themselves clean. The hadith which says that the cleanliness is the half of the iman. So this is very important that it's hand washing or the cleanliness is not just an option for us. It is an obligation by Allah subhanahu wa ta'ala, and it is being instructed by our Prophet for every one of us to keep ourselves clean, and particularly our hands. So the hand cleanings have been more than 17 hadiths in different books of hadiths, and some of the hadiths are being quoted in both in Muslim and Bukhari and Muslim, and some of the hadiths are quoted in other books of hadith. And there are 9 ayah of Quran which directly describe how to keep ourselves clean, and particularly cleaning our hands are very important. Another aspect of this pandemic is that it has been sent by Allah subhanahu wa ta'ala. We never know any disease cannot be contagious unless Allah subhanahu wa ta'ala make it contagious. It's shown in the hadith as well. And another very important thing is social distancing. It also comes from the teaching of Rasulullah and the teaching of Quran. And some people say that making a gap in prayer is not allowed in Islam. I think it's a misunderstanding of Islamic ideology. Yes, in normal situation we keep ourselves shoulder to shoulder in prayer, but in a special situation, it has been described.
थोड़ी सी आवाज में स्टार्ट करें, थोड़ा सा स्लोली प्लीज।
In a special situation, one should be very careful about that. I just want to share with you one of the action of Amr bin As. He was a very renowned commander of the Umar Radhiyallahu, and that gentleman actually he played a very important role in the prevention of epidemic in Syria and around the surrounding area. So what he said to the people? He said that I heard from Rasulullah Sallallahu Alaihi Wasallam that the plague is like a flame. And so protect yourself by displacing yourself from one place to another. It's very important that whenever there is a pandemic, we should keep ourselves at a distance from each other. So that keeping in a staff or in a row with shoulder to shoulder has been removed here because of the certain important situation and a difficult situation which has been described in pandemic. And therefore, Umar bin Has said, remain in an arrow distance from leprosy patient. He quoted in a hadith of Rasulullah Sallallahu Alaihi Wasallam, and which has been described in Muslim as hadith, say, remain an arrow distance from from the leprosy patient. This shows that the arrow's distance is like 6 feet distance. The arrow was at that time 6 feet long. So therefore, when it is described that we should keep at least 6 feet distance, that has been driven from the hadith described. And another important hadith which has been described also in Bukhari and Muslim both. Whenever you see a patient with the leprosy, run away from this patient as you run away from lion. So whenever you see lion, you don't try to come near to them. You try to run away from this wild animal. So this like the pandemic is like a wild animal, and we should need to keep ourselves away from that. And keeping a distance has been described in Quran and Sunnah, and therefore it's not an optional that we should keep in distance. And what happens is whenever you are standing in a row, particularly in during Eid, and you make a gap, and some people enter into that gap and they try to fill that gap, and probably they are unable to understand the actual the teaching of Islam. So at the end of the day, it is very well understood that every disease has a cure. If the cure is applied according to the diet or with the permission of Allah subhanahu wa ta'ala, Allah bestows the care. It's Sahih hadith says. So if we don't know the cure of this disease, we need to do some research, we need to struggle, we need to put some effort to find out the cure of this disease, and with the permission of Allah subhanahu wa ta'ala, Allah subhanahu wa ta'ala will bestow. Now, let's come to today's topic is about the Qurbani. The Qurbani is a very important religious obligations. According to Hanafi school of thought, it is considered as not, but it is wajib. And in other school of thought, Hamdi and other school of thought considered as wajib. But one should understand that Allah subhanahu wa ta'ala said neither their flesh reach to Allah subhanahu wa ta'ala nor their blood. It is your piety, and it is basically taqwa is a piety, the Allah consciousness which is to Allah subhanahu wa ta'ala. One should be very clear about that. That shedding of blood is important, but this does not lead to Allah subhanahu wa ta'ala. It is niyyah behind that, and it's your taqwa behind that which leads to Allah subhanahu wa ta'ala. In this coronavirus, one should be certain important precautions should be taken to prevent the spread of this disease among the Muslims and non-Muslims. We are not talking about the protection of the Muslim. We are talking about the protection of the community as well. So, if possible, The sacrifice, we know, it might be the essential for a few people, for all those people is essential, those who can pay the cost. So this is a simple thing that can be. We need to encourage the online purchase of the animal if it is possible. It may be possible to halt the establishment of cattle markets by the government outside the city and allow the people with the strict social distancing and the SOPs to purchase the animal. And illegal sale and markets of the animal should be prohibited. And we should not promote this illegal sale. We should not enter into the deal with those people who are doing this kind of mess in the city. By doing the Qurbani, the blood of the animal should not be allowed to flow on the roads and streets. We should take care about that. It is better to do by Qurbani. That means we can collect and purchase the animal and do it collectively in a certain place outside the city and outside the community, so that the blood and the other dirt should not spoil our environment. One important aspect which has been described in Quran and Sunnah is the animal should be sacrificed on the soft earth, should not be on the hard earth, that means should not be on the metal. And less a person should go to purchase the animal. Senior people, the children should avoid going to that place. Mask should be worn at all times and sanitizer should be used at all times whenever you want to enter into that market. Methods of Qurbani, again, I told you that the hides and intestine should be disposed of immediately and should be cleared out. More meat should be given to the poor, and this year, if you can do a sadaqah, and that should be given to the people who died of this other way. Sorry. What is about the EIDUL Adha communication? And that stands true for the procession, the Muharram procession as it is. Prophet used to go outside. It's another hadith which has been quoted by Bukhari and a white praying in the mosque. So Rasulullah said they go out of the city, out of to the open place to pray either Eid, not only Eid al-Fitr as Eid al-Adha. Both Eid should be prayed in the open space. If you are compelled to pray in the closed mosque, you should keep distance, and if not possible you can do 1 or 2 or 3 Eids with the different imam, and that is allowed by all the then each should be prayed before the Qurbani. If you miss the Eid, you can pray. Some majority of the ulama, they allow to pray Eid at home as well, except Hanafi ulama. And I was surprised to know that initially, in the beginning of they allowed it to pray Jummah at home, gathering few people of the home and praying Jummah, and thereafter they took away this fatwa. But to my understanding, it can be prayed at home when the few people will pray at home. The either other prayer you can pray at home as well. And this Eid prayer should not actually harm other people around. Whenever you are praying in the mosque, all precautions taken, and that has been described by the scholars as well. And to wear the mask at all times, when you enter into the mosque, wear the mask at all times, to avoid hugging and each other. Ill persons and those who are over the age of 60 and children should avoid going to the Eid. This year, to avoid spread of the coronavirus, traditional gathering like Eid Milan parties, friends party and relatives gathering should be avoided with our class. And we should pray to Allah subhanahu wa ta'ala to accept all our worships and all our sacrifices. I quoted few other hadiths here, and just I want to finish with the take-home message that do not just think about yourself. We urge everyone to choose mercy, wisdom, and generosity. Prevent the spread of the disease, practice correct hand hygiene, ensure cough etiquette, and that's it. Rasulullah whenever he sneezes and cough, he used to put his hand in front of his hand, and used to put his arm in front of his mouth. And avoid touching your face. Do not shake hands and hug or kiss the cheek. Look after your community. Do not add to the panic. Many people, they add the panics in the society. Just avoid and try to discourage the panic. Do not share unverified information. And there is a hadith which says, that means that it is enough to be a liar when you hear something and that you communicate to someone without verifying the certainty of that information. Check in those who are vulnerable, and those who are vulnerable should be taken care of. Sport healthcare professionals are the time. Those healthcare professionals who speaks and say, and they are on the front line, and we need to support them all the time. And our nurses and the doctors should be respected. Do not stockpile. And it's a very unfortunate phenomenon in our society that whenever we listen something, we try to stockpile the things that as if they will not be available today. Please do not be panicked and buy in bulk. It will be enough for you and for the others. Start at the local store rather than going to the other. Help the mankind. Those who are already most vulnerable are at great risk. Send your support to and strengthen the vulnerable population. Instead of doing QURBANI at home, you can send it for the vulnerable population, those who are poor, those who are in villages, and those who need more. You can send your QURBANI to those people. And there are so many other organizations like Shifa Foundation, Tameer-e-Millat Foundation, so many other foundations are doing this job, and they are providing meat and to the poor and the needy people. The fact of how you are positive and negative, always think that your action is positive or negative. Ask though, and whenever you have a trouble or you don't know something, so it is said in Quran very clearly, ask those who knows if you don't know. So I think it is enough today. I've already taken my time. Thank you very much. If you have questions, answer it. Thank you very much.
Iqbal, I think that was an excellent, elaborative, very comprehensive aspect about religion and this COVID-19. You have covered so many aspects that I was not, even though you went overboard, but I thought I would not stop you because it was so useful, and so many aspects that Islam covers, addressing disease and epidemics and illness and treatment. And I think this was very useful. So I urge everyone to please send in your questions. We will move on to our next presenter, Dr. Mumtaz Ali Khan. He is the Chief Medical Officer, Certified Field Epidemiologist at National Institute of Health. And he is representing the government. And he's going to talk about guidelines for Azha for prevention of coronavirus and also other diseases such as Congo hemorrhagic fever. Dr. Mumtaz.
Thank you so much, Dr. Jaz, and thank you so much, Professor Iqbal, for such nice talk. And it is really informative for me, for others, and for all the doctors. I'll be talking a little bit about coronavirus in Congo during the challenge during this Eid. Most of the topic has already been covered by Professor Iqbal, but a little bit I will talk about. Potential challenges we will be facing and we are facing during this Eid, that the population movement and sale of sacrifices animal ahead of Eid al-Azha, and public gathering around mandis and markets. This cause close interaction with animals, close interaction of human to human, and gathering at grocery shops and markets for buying things and buying clothes, shoes and everything. Travel across the country to go their villages and to go there to see their relatives, and also environmental pollution due to animal carcasses and blood. These are the potential challenges that which we will be talking a little bit. The targeted areas which needs to be considered potential risk for COVID transmission are cattle markets, bus stands and vehicle transport, public transport, grocery shops and markets, family gatherings during Eid and after Eid, relative gatherings, family gatherings, friend gatherings, and also the mosque, masjid and Eidgahs. These are the potential areas of risk of disease transmission. So, public gathering is the main risk during such religious gathering, and especially this Eid, it causes a lot of gathering in the markets, which causes animal to human interaction, and environmental pollution. Travel is also another risk for disease transmission. Staying home is best way to protect yourself and others from getting risk. But if travel is necessary, please travel in your own car, or even avoid traveling to their villages, because this is a great risk. And if we see the markets and bus stands, it's really crowded during Eid days. Next, please. Eid prayer is especially important on Eids, and this is really everyone want to pray in the gathering. But as Professor Iqbal said, that it should be outside the town, it should be an open space, and please ensure that you should have ablution from your home, and you should have your own jainamaz or rug to the masjid, and you should wear mask every time during prayer time, and please don't shake hands and don't hug after Eid prayer. This is very important message for you all. We see that unnecessary gathering around sacrificing animals. Everyone comes and see how the animals is being cut down. So this is a really great risk for COVID and CSHF transmission. So avoid unnecessary gathering, avoid elders and kids to be there around the animal sacrifice area. So there is a risk of zoonotic diseases like brucella, like Congo, and also the current disease pandemic, COVID-19. So because of direct contact with animals, screaming Congo, hemorrhagic fever, and brucellosis, these are major risks. So what is the risk of COVID during this Eid? You all know about it. We are facing a great pandemic in Pakistan and other countries around, and this is not ended now. Although the infectivity is decreased, infections and positivity is decreased, but still we are at risk, because you can see from the global data, there's India and some other countries have again facing a large number of cases and deaths. This is a second wave, so second wave is expected. And by practicing such gatherings and going to such gatherings without any precautions, we are welcoming the second wave, and it will cause another wave like we experienced during Eid al-Fitr and after Eid al-Fitr. You know about the Crimean Congo hemorrhagic fever, because this is our friend from since 1975 that the first case was detected in Rawalpindi, and since then we are getting sporadic cases around every year from around the country, from every area, almost from Balochistan and other areas. And CCHF is transmitted by ticks. Ticks are almost found on the kettles. You can see, you must have seen on the kettles. And these can be found in domestic animals such as cattle, sheep, and goats. And during Eid, there is a great risk of tick transmission and disease transmission because of gross animal movements from rural to urban areas. This is more common for non-professional butchers and freelance, because we see a lot of non-professional butchers around during Eid, and slaughter is commonly performed on the roadside and in the homes and the towns and the communities. And if we see the trends of CCHF where positive cases are compared, it was shown in 2013 that more than 85% of the cases of the total year were after EIDUL Azha. This is the trend you can see from the rising graphs, that most of the cases during last 5 years or 6 years, it was after June, July, and this is due to the animal movements. Yeah, this is our own data. This is evidence for this disease that we should take care of CCHF as well.
And
yeah. So what precautions we are recommending for COVID and CCHF? Is already discussed by Professor Iqbal that this is good to have Ijtimai Qurbani, because many organizations and even our Masajid, AIMA and other welfare organizations are providing this opportunity and facility for Ijtimai Qurbani. And this is good to encourage online buying if available for persons around, and ensure kids and elders not to visit the markets and animal markets and mandis. Always wear mask and gloves while visiting animal market. Minimal handling of animals is recommended, and keep animals away from home till Eid day. Don't keep animals till the Eid at your home, because kids and everyone is at risk because of the ticks and other diseases. The government is already arranging separate areas for the animal markets, but still we can see that much more animals are around on the streets, in the road. So wear surgical mask or medical mask, and sanitize your hand and wash your hand when you come back from the animal market. And don't touch the unnecessary areas and surfaces in the market. Avoid touching your hand, eyes, mouth, and nose, and maintain the distance, the recommended distance. And if you see any non-compliance at the market, report to the authorities, because authorities are always there to answer the question. In Islamabad and other areas, the government has already arranged separate places, but still we can see the animals on the roads and streets. So ensure face masks, ensure hand sanitizing and gloves, or alcohol-based hand rub should be there available at every entry and out. And display noticing for promotion of these precautions, like the government is already providing these some banners and other things around. This is very difficult to arrange markets of animals, because everyone is not too literate to understand, but still we can protect ourselves individually. Don't expect from the government and others to provide you the safest areas. So this is very important to practice precautions on yourself, and especially disinfect the areas where animals you tie at your home. So the site of slaughtering should be away from general public and your home. Don't allow crowd around the slaughtering place. Practice physical distancing while slaughtering the animals, and always wear mask and gloves, perform hand hygiene, wash and disinfect the surfaces. Disinfection is very important, and we will be talking in the next slides how to disinfect the surfaces, and dispose the carcasses and the remnants of the animals properly, because we can see a lot of stuff lying on the roads and streets after EIDUL Adha. So this is not good for the environment and your health. So how to process meat at home, because this is a great risk for ladies working in the kitchens to get infected with CCHF. Always we have cases of such infections from kitchen as well. So the meat the meat at the kitchen is also a great risk for CCHF. Wash hands, wear kitchen gloves, keep the kids away from the kitchen during processing of the meat, and for distribution, make sealed packs and safe, and thorough wash and cook meat as well. Eidgah is very important. Already Professor Iqbal talked about it. It should be outside the main town. Social distancing must be practiced. Take your janamas from home. Do your wuzu from home, and avoid handshaking and hugging during after prayer. And if you are praying the Eid prayer at mosque, this is very important for Imam to deliver a speech about the preventive measures of COVID in Congo. And windows and doors of the mosque should be kept open for better ventilation. Carpet should be removed from the mosque, and floor should be washed with chlorine solution, chlorinated water. And water cooler should not be used. Ablution sections and washrooms must be kept closed during the prayer and before the prayer as well, and avoid crowding at entry and exit. There should be separate entry and separate exit to avoid bottlenecks. What to do on Eid days? Family visits, Eid general family get-together should be avoided as possible. Eid shopping must only be restricted to essential things, and at the times when markets are not very crowded. And Eid embracing like handshake and hugs should be avoided during this Eid, because this is very important to keep yourself safe and your kids safe. Social distancing, ablution, already we talked about it. And you know about the prevention of CCHF. We already talked about it. And the butchers must wear personal protective equipment, and this is very important. If they have the gown, the waterproof gown, this is very important to wear. And also the person who is involved in the sacrifice, because we are ourselves want to do sacrifice in the villages and every area, so they should perform hand hygiene and wear protective clothing during sacrificing and cutting up the animal. Some departments like veterinary department and municipality are arranging sprays on the animal to get rid of the ticks, but the sprays and everything should be at the entry of the animal market. This is already too late because we have the animals around, so we should keep our own safe from the ticks. These other acaricides are used, but 14 days before the animal come to the market. It is too late now. But some organizations have already practiced this for safety of the public. And if you see any tick on the animal, don't remove on the hands, because this is very important. It can bite you. Remove with the forceps or any thing like this, it's shown in the picture. So have a safe Eid and Eid Mubarak. Thank you.
Thank you. Excellent. I think, Dr. Mumtaz, you were very good because your time was short. So we will go on to the question. You can still send in your question, and we will have a nice discussion, I'm sure, as usual. So we'll start with the first question. Assalamu alaikum. Good session. Zaid Naeem Saab पूछ रहे हैं आपसे, it's not better to give money to charity organizations, khidmat or shaukat or khanimar ijtimai. Thanks for taking the risk. Okay, so appreciate seminar. It's the time of need to have such seminars. We need awareness. What else, Dr. Sabra is asking about, what else precautions should be observed to avoid enteric Congo virus and other meat-related disease? So there is Dr. Mumtaz, meat बज़ाते खुद उससे COVID-19 ट्रांसमिट हो सकता है, ये पूछने की कोशिश करें. मेरे ख्याल में और CCHF का भी आप उसी में जिक्र कर दें.
मीट से बज़ाते खुद नहीं है, क्योंकि अभी ड्यूरिंग प्रेजेंटेशन एक स्लाइड पे कहीं था कि कोई एविडेंस नहीं है कि केटल्स में या इस तरह एनिमल जो सैक्रिफाइसिंग एनिमल्स है उसमें अभी तक कोविड का कोई एविडेंस नहीं है. इसलिए मीट से बज़ाते खुद कोविड का तो नहीं है, लेकिन मीट अगर ऐसा बुचर या ऐसा बंदा उसको प्रोसेस करे जो खुद कोविड का इन्फेक्टेड हो या एसिम्प्टोमेटिक हो, उनको पता ही ना हो, तो वो हो सकता है उससे ट्रांसमिशन. दूसरा, मीट से कांगो ट्रांसमिट हो सकता है, इसलिए ज्यादा प्रिकॉशंस लेनी चाहिए ताकि उनकी जो लिक्विड्स है या जो ब्लड है उस पर लगा उसको प्रॉपर वॉश किया जाए विद ग्लव्स और उसके बाद हाथ धोए जाए.
अगला 3 सवाल यही है और वो यही है कि are there any cases of transmission of corona from animals to humans? Can it spread? Animals spread the COVID-19, and how much chances to spread corona in animals from animals to humans?
एनिमल्स में अभी तक एविडेंस
और वाइस वर्सा और व्हाटएवर,
लेकिन एनिमल्स चूंकि गैदरिंग है, वहां पे लोग आ रहे हैं, और अगर एक बंदा भी इन्फेक्टेड हो और उस गैदरिंग में उनसे और लोग इन्फेक्ट हो सकते हैं, एनिमल से नहीं है, ह्यूमन टू ह्यूमन ट्रांसमिशन के चांसेस बहुत होते हैं बिकॉज ऑफ क्लोज गैदरिंग।
जी बिल्कुल। इसमें जो है ना, असल में ये कि वी नो फॉर साइंस एविडेंस ये है कि जो कोविड है वो फैलता है ह्यूमंस टू ह्यूमंस। जो कोविड एनिमल्स में, कोरोना वायरस जो एनिमल्स में अगर है भी, उसका बैक टू इन्फेक्शन, बैक टू ह्यूमंस ट्रांसमिशन का एविडेंस कोई नहीं है
अभी तक नहीं है।
ठीक है। सो बट आप वो कहते हैं कि आप फिर भी प्रिकॉशन लें, क्योंकि देखें अगर वहां पे कोई ह्यूमन है जो कि इन्फेक्टेड है and he is touching the animals and you are going and touching the same surface, then it is a potential that it will be kind of a you can get infected. ठीक है। What do you think when situation get better, when COVID pandemic will end? ये कई दफा हर दफा आता है, तो पब्लिक हेल्थ के एक्सपर्ट जो होते हैं वो आपके क्या ट्रेजेक्टरी पाकिस्तान के लिए और दुनिया के लिए पेंडेमिक 19 कब खत्म होगा? सारे थक गए हम ये वेबिनार करते हुए, लोग सुनते हुए, और ये सवाल भी बार बार आ रहा है हमारे पास।
हम खुद भी थक गए हैं, और ये अच्छा क्वेश्चन है, लेकिन स्टिल कोई बंदा ये बता नहीं सकते कब खत्म होगा। although we are at decreasing trends, लेकिन जिस तरह बाकी मुल्कों में सेकंड वेव आया है, इस वक्त इंडिया 3rd पोजीशन पे है दुनिया में, और इनमें केसेस दोबारा राइज कर रहे हैं। सो डेफिनेटली वी आर एट रिस्क, सो वी शुड चेंज आवर बिहेवियर्स। और जिस तरह हम अपने आसपास देख रहे हैं कि कोई ना मास्क पहन रहा है, ना कोई SOPs प्रैक्टिस कर रहे हैं, सो दिस इज ग्रेट रिस्क। सो वी विल रिक्वेस्ट फ्रॉम दिस वेबिनार टू ईच एंड एवरीवन to practice yourself as well and spread this message to other around as well.
डॉक्टर प्रोफेसर इकबाल, मैं आपसे ये पूछना चाहता हूँ कि एक क्वेश्चन ये है कि हमारे जो उलमा हैं उनका क्या रोल होना चाहिए खास करके इस सिचुएशन में, और ईद उल अज़हा के पर भी ना, क्योंकि देखें अगर हम ये एक रिलीजियस फेस्टिवल है और आगे हमारे पास ये आ रहा है मुहर्रम है, फिर उसके बाद ये है रबीउल अव्वल है, इस तरह के इज्तिमा होते रहेंगे, वहां पे भी इसी तरह की सिचुएशन राइज होती है। तो उसमें डॉक्टरों का तो ठीक है रोल है, पब्लिक हेल्थ वालों का, लेकिन रिलीजियस जो स्कॉलर्स हैं उनका क्या रोल होना चाहिए और किस तरह इफेक्टिव अपनी वो मैसेज पहुंचा सकते हैं? डॉक्टर इकबाल।
मेरा ख्याल ये है कि हमारे उलमा ने इर्रिस्पेक्टिव ऑफ जो कहीं के भी आलम हो, जो दुनिया के उलमा ने इसमें बड़ा पॉजिटिव रोल जो है वो प्ले किया है। और जो डॉक्टर्स या एक्सपर्ट्स हैं, मैं आपके साथ एक हदीस शेयर करना चाहता हूँ। जब रसूलुल्लाह सल्लल्लाहु अलैहि वसल्लम मदीना शरीफ तशरीफ लाए तो कुछ लोग some people were doing budding on the dead street, and therefore Rasulullah sallallahu alaihi wasallam disliked it, and the people they stopped doing budding, and next year there were very few crops, and the people they asked Rasulullah sallallahu alaihi wasallam, this year we didn't do the budding, and therefore we received very less crop. Rasulullah said, you know your professional matter better, so it is better to practice whatever you like. So it is very important, the tool for us, that all of us being a Muslim, it is the responsibility of the specialist. We should leave the things on the specialist and follow the specialist instruction. It is obligatory. It is not just I wanted or don't like. यानी मैं चाहता हूँ या नहीं चाहता हूँ, या मेरा दीन ये कहता है मेरा दीन नहीं कहता। We need to, it is the sunnah of Rasulullah sallallahu alaihi wasallam कि हमारे जो डॉक्टर्स जिस तरह कह रहे हैं हमें उसके ऊपर अमल करना चाहिए। ये एक और चीज। दूसरी चीज ये है कि अगर किसी एक शख्स को भी हमारी वजह से नुकसान हुआ, ये नुकसान इस सूरत में फर्ज क्या हम एसिम्प्टोमेटिक हैं, हमें नौजवान है या हमें डिजीज नहीं है, और हमारी वजह से किसी एक बूढ़े शख्स को या बीमार शख्स को या vulnerable शख्स को बीमारी ट्रांसमिट होगी, we should be responsible for that, and we should feel the responsibility throughout our life. And I request the ulama, the religious scholar, so I know that they don't have much knowledge about the pandemic, but they have guidelines. Then why they don't follow the guidelines? The guidelines have been given in Quran and Sunnah by Sahaba, and the practice of Sahaba is very elaborate for us. Why they don't follow the Sahaba? Amr ibn As radhiyallahu anhu, if you go to in the detail, when you asked me to speak on this topic, so I went to see what are the basic guidelines. There are elaborated basic and advanced guidelines available in Quran and Sunnah, which says that we should be more and more careful. So I just want to share with you the meaning of taqwa. Most of the people in Pakistan and around, they think that the taqwa means just to fear of Allah subhanahu wa ta'ala. It is not just the fear of Allah subhanahu wa ta'ala. हम अपने माँ बाप से डरते भी हैं और उनका एहतराम भी करते हैं, उनका ख्याल भी रखते हैं, उनकी केयर भी करते हैं, और एट द सेम टाइम उनकी खुशनुदी का ख्याल रखते हुए उनकी जो गज़ब है या उनकी जो उससे हम डरते भी हैं. इसलिए the taqwa is something in between the खौफ और जो हमारी जो मोहब्बत है उसके दरमियान में एक चीज है. The taqwa is the caring of Allah subhanahu wa ta'ala, caring whatever Allah subhanahu wa ta'ala has commanded. What Rasulullah sallallahu alaihi wasallam given us is caring of those ihkamat and caring of those orders and those the way of life which he has described in Quran and Sunnah. Therefore, it is very important for our ulama, irrespective of our personal motivation, whatever they are. We should guide the people according to the Quran and Sunnah. And the Quran and Sunnah says, don't try to spread the disease among the, don't try to spoil your community, don't try to hit someone, don't try to injure someone. And I shared with you that one of the important, I spent some time extra to share with you the important aspects and the important principles of Sharia, and that we cannot inflict harm to anyone. It is prevention of harm is more important than provision of some benefit. So if our actions are beneficial, it's not very important. Our action should not be harmful to the other people, and that should be spread by our ulama, should say to the people the truth, what is written in a Quran and Sunnah, rather than our own implication or rather than our own explanation of everything. Thank you very much.
आप लोग की वजह से अगर कोई बीमार हो गया तो this is a great disservice to humanity and overall. तो मेरे ख्याल में जो डॉक्टर इकबाल ये कह रहे हैं कि आप किसी को इंजर ना करें, आपकी वजह से किसी को तकलीफ ना हो और किसी वजह से कोई बीमार भी ना हो. 2-3 सवाल रह गए. एक will you be sharing the webinar talk? I think we will be sharing. Yes, we will. एक सवाल ये है कि डॉक्टर मुमताज कि how to prevent gathering at कुर्बान गाह, कि वो लोग बहुत से जमा हो जाते हैं, तो उसको कैसे यकीन क्या वहाँ पे पुलिस है, वहाँ पे किसी को सीनियर लोगों को कहें, रिलीजन वाले बैठे वहाँ पे जो इंडिविजुअल्स हैं उनका रिस्पॉन्सिबिलिटी बनती है.
इंडिविजुअल्स के इसलिए बनती है कि कुर्बानी को एक जगह तो हो नहीं रही कि गवर्नमेंट वहाँ पे पुलिस खड़ी कर दे या कोई इज्तिमाई जगह तो है नहीं, ये जगह जगह होगी. और जिस तरह हमारे प्रैक्टिसेस है घर के सामने, फिर लानों में, फिर every we are expecting this gathering. So बेहतर है कि हर इंडिविजुअल खुद ही उससे दूर रहें, बेशक दूर खड़े हो लेकिन गैदरिंग ना करें, और जहाँ पे ब्लड शेड हो, जहाँ पे एनिमल्स खड़े हो वहाँ के करीब स्पेशली बच्चों को और बूढ़ों को ना आने दें. जिसने कुर्बानी करनी हो वही करीब जाए, वही उसमें जो अपना रोल प्ले करें, और जिसने सिर्फ देखना हो दूर से ही देखें, एक दफा देख के चले जाए अगर जरूरी है देखना. पहली बात तो ये कि बिल्कुल देखे ही ना, गोश्त घर पहुंच जाएगा. इज्तिमाई कुर्बानी की बहुत अच्छे इंतजामात हैं और आपके घर रोड स्टेप पे ड्रॉप करेंगे. अगर जाना लाजमी है तो कम से कम फासला रख ले वहाँ पे, और ग्लव्स पहने, मास्क पहने, और कोशिश करें कि अपने कपड़ों को और बूट पहने उस एरिया में जहाँ पे एनिमल्स खड़े हैं, क्योंकि टिक्स आपको आपके पाँव के जरिए चढ़ सकते हैं. आपके कपड़े वाइट हो जिसमें आप टिक्स देख सकें, अपने कपड़े एग्जामिन करें घर जाने से पहले, कहीं टिक्स आप घर तो नहीं लेके जा रहे हैं.
और ये भी याद रखें कि जो कॉन्गो हेमरेजिक इज एक्सट्रीमली फेटल डिजीज, अबाउट 60%, 70,
ऑलमोस्ट 40%
मोर्टेलिटी है उसकी जी, और कोविड की तो 2% के करीब है. तो ये यकीन करें कि CCHF का जो रिस्क है हमेशा हर साल होता है, और हम देखते भी हैं, हम डॉक्टर्स हैं देखते हैं, तो उसका बहुत रिस्क है. प्लीज अवॉइड करें. और अगर इससे बेहतर तो आजकल वो आगे आप फेस टाइम कर लें या वो वीडियो देख लें उनकी, ऑनलाइन देख लें अगर आपने देखना जरूरी है. एक और सवाल है Dr. Iqbal, आपसे, what is your opinion? When will the best time to open the institute? क्योंकि देखें आपकी यूनिवर्सिटी है, आपकी कॉलेज है. It's better to open institute after Eid.
It's better to open the institute when it is feasible. So you cannot open the institute altogether. That means the campuses cannot be opened at once. There should be stage-wise opening. If you open the institution at once, then there is a danger of spread of the disease as well. If one, therefore, I will recommend that those classes, graduating classes, for example, final year MBBS or final year BDS or final year whatever, they should be called first, because their deficiency they will carry on throughout their life, and therefore the institution should be open for the final year class first, and thereafter you see the response of the people, and we should be abiding. The HEC has laid down strict SOPs for the opening of the institution. Though the government has announced from 1st September to open the institution, but some institutions are being opened after the Eid, only for the final year students. So I hope the gradual opening of the institutions after the Eid, maybe after 15th of August, will be feasible for majority of the institutions, postgraduate institution, and particularly the tertiary care institutions like universities, the colleges, etc.
Thank you. Dr. Mumtaz, what about schools? बच्चों की जो सारी वो रुकी हुई है, ऑनलाइन क्लासेस हैं, लेकिन मेरे ख्याल में उसका नेमल बदल तो नहीं हो सकता.
नहीं, बिल्कुल नहीं हो सकता, क्योंकि बच्चे तो ऑनलाइन क्लासेस में उतना बेनिफिट नहीं ले सकते जितना कि हमारे बड़े बच्चे जो मेडिकल कॉलेजेस में हैं. जैसे सर कह रहे हैं कि ग्रेजुअल ओपनिंग इज रिकमेंडेड, और वो स्कूल जहाँ पे जो सिटिंग अरेंजमेंट में डिस्टेंसिंग नहीं हो सकती, उनको तो बिल्कुल आखिर में खोलना चाहिए. और एक ऑप्शन और है कि हम दो शिफ्टों में कर दे ताकि डिस्टेंसिंग इंश्योर हो, क्योंकि एक क्लास में जो पब्लिक और प्राइवेट स्कूल्स हैं तकरीबन 30 से 40 या 60 तक बच्चे होते हैं, तो वो बिल्कुल साथ साथ बैठे होते हैं, जिसमें ट्रांसमिशन रिस्क बढ़ जाता है. तो कुर्सियां जो है स्कूल चेयर्स, उसमें डिस्टेंसिंग इंश्योर कर दें, और अगर एक टाइम पे सारों को नहीं बुला सकते तो 2 शिफ्टों में कर दें. तो जब तक ये अरेंजमेंट नहीं होती, मेरे ख्याल में स्कूल खोलना विल बी अनदर रिस्क फॉर ट्रांसमिशन.
ठीक है. एक सवाल आपसे डॉक्टर मुमताज ये लिखें, अकॉर्डिंग टू गवर्नमेंट कोविड-19 इज मच हैंडल्ड अप टिल नाउ, इज इट ट्रू, एंड are the testing kits finished to test more patients?
डेफिनेटली जितना गवर्नमेंट ने और जितना पब्लिक प्राइवेट हर बंदे ने इसमें रोल प्ले किया है, एंड वी हैव टू प्ले द रोल्स इन द सेम मैनर. क्योंकि एक मैं पढ़ रहा था चाइना के एक आर्टिकल, उसमें उन्होंने बड़ा अच्छा लिखा हुआ है कि वी हैव टू डांस विद द वायरस फॉर लॉन्ग. सो ये वायरस हमारे आसपास है, हमने इनके साथ रहना है जब तक प्रॉपर वैक्सीनेशन या प्रॉपर इनकी वो ना हो. इसलिए हमें ये प्रैक्टिसेस कंटिन्यू रखनी चाहिए.
खत्म भी नहीं हुआ,
और ये खत्म भी नहीं हुआ. और रही बात टेस्टों की, तो टेस्ट आर अवेलेबल. गवर्नमेंट जितने भी इदारे हैं जो डिस्ट्रिक्ट हेडक्वार्टर हॉस्पिटल्स हैं, हर डिस्ट्रिक्ट में फ्री ऑफ कास्ट टेस्ट की सहूलत अवेलेबल है. और प्रोविंसेस में ये तकरीबन इस वक्त मोर देन 100 प्लेसेस पे गवर्नमेंट ने अरेंज की हुई है. इसलिए जो भी टेस्ट करना चाहे वो आए, टेस्ट करवाएं. जिनको बुखार हो, जो डॉक्टर्स प्रिस्क्राइब करना चाहें वो जरूर करवाएं. और गवर्नमेंट ने फ्री ऑफ कास्ट दिया है. कुछ प्राइवेट ऑर्गेनाइजेशन भी ऑफर कर रहे हैं नॉमिनल रेट्स पे, लेकिन गवर्नमेंट के पास फ्री ऑफ कास्ट किट्स भी अवेलेबल है, टेस्ट भी अवेलेबल है.
डिस्पोजेबल ऑफ एनिमल्स के जो है उससे कोरोना फैल सकता है?
जो एनिमल की कार्ससेस है या उनके रिमेनेंट्स है, उनसे कोरोना तो तभी फैलेगा जैसे आपने बात की कि सरफेसेस पे अगर कंटामिनेटेड हैंड से उनको हैंडल करें,
वैसे नहीं.
लेकिन ग्लव्स पहन के अगर उसको आप प्रॉपरली डिस्पोज करें तो कोरोना का इतना चांस नहीं है. इससे कांगो और बाकी डिजीजेस का है, इसलिए बेहतर है कि प्रॉपरली डिस्पोज करें. रोड्स पे और स्ट्रीट्स में उनकी जो उजड़े वगैरह ना फेंकें ताकि न बदबू फैले और न बीमारियां फैलें.
Thank you. A lot of people have really appreciated our session. सबने काफी कहा है कि बड़ा इन्होंने इससे मुस्तफीद हुए. मैं आखिर में डॉक्टर मजूब काजी का एक ये है कमेंट है कि पढ़ लेता हूँ. I think this whole pandemic, the role of pulpit masjid cannot be eliminated. It can be the center of public health education and awareness, hence tackling the dangers of spread of infections. And as also the monsoon season is around the corner, I hope proper disposal of animals is ensured. otherwise we will have faced different infectious diseases additional to COVID-19. इसमें तो काफी वजन है. Thank you, Dr. Qazi, for that comment. And I think very nice session. In the end, I would like to ask Professor Iqbal to say a few concluding remarks, and then I will come back and finish up. Thank you.
In conclusion, I will recite Surah Asr. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Wal asr innal insana lafi khusr illa allazina amanu wa amilus salihati wa tawasaw bis sabri wa tawasaw bil haqqi wa tawasaw bis sabr. This very small surah, in fact, in case our whole life spans, whatever we do, whatever we say, at the end of the day, it is very important that we should say the right thing. We should be on the rightest path. We should be on the correct path, and we should be knowing what correct is. It is very important. The majority of the time, we think that we are on the correct path, but we should be knowing what correct is. If we don't know, ask those who know. As several times said in the Quran. So the one important aspect of our life is that whenever we do something, we should be knowing what is the righteousness, what is the right thing, and what should be we should be on the rightest parts of the path. And the second thing, whenever you are on the right path, you will face difficulties. And in difficulties, in difficult times, in testing time, one should be very, very patient. Should not be spreading panic. Should not be having बेसब्रा नहीं होना चाहिए इंसान को. जो फाइनल चीज इसमें कही गई है वतवासो बिल हक़ वतवासो बिस सब्र. We should ourselves should be patient और ये सब्र की दूसरों को भी तलकीन करते रहें, तो इंशाल्लाह कभी भी जिंदगी में नाकामी नहीं होगी. If आपको apparently कुछ चीज नाकामी भी लगती हो, तो वो भी कामयाबी ही होती है अगर if we are on the right path. So by this I would say thank you to everyone. And the last thing what I say is I'm not the mufti of this session. Please, I have very little and very limited knowledge of deen, but I try to. We always try to give some authentic information to our people. It is another our prime responsibility. What information you have, it should be authentic. You should transmit only the authentic informations. जो भी आप कहना चाहें. और मैंने आपसे ये हदीस भी शेयर की थी कि फ़ाबिल मर्ह काज़िबन अन युहद्दिसु बिल. It is enough to be a liar that you spread or you transmit the things which you have listened from someone without authentifying it. तो ये हमारा रवैया हमेशा पॉजिटिव होना चाहिए जिंदगी में भी, और इंशाल्लाह आखिरत में भी हमारा रवैया पॉजिटिव ही इंशाल्लाह होगा. और फिर ये कि हम एक दूसरे के साथ हम जब भी मिलें तो अल्लाह के लिए मोहब्बत करें और अल्लाह के लिए ही दूसरे के साथ. और अल्लाह के नबी सल्लल्लाहु अलैहि वसल्लम ने हमें ये तरीके अपनाने का कहा है. इनको अपनाना सुन्नत का हिस्सा है. ये कोई अपनी तरफ से हम गढ़ के नहीं लिया है. मैंने आपके सामने जितनी हदीस और डॉक्टर मुमताज ने जितनी चीजें शेयर की, ये सारी सुन्नत का हिस्सा है. और सुन्नत वही चीज है जो अल्लाह और उसके अल्लाह और उसके रसूल सल्लल्लाहु अलैहि वसल्लम की तरफ से ट्रांसमिटेड हम तक हुई है. अल्लाह की सुन्नत है, उसके नबी की सुन्नत है. तो मेरे ख्याल में हम सबको वाकिफ भी होना चाहिए. थोड़ा बहुत दीन से हमें वाकिफ होना भी, कि मुस्लिम डॉक्टर में वाकिफ होना चाहिए, ताकि हम जब किसी से बात करें तो एथेंटिसिटी के साथ बात करें. बहुत बहुत शुक्रिया. तो मेरे ख्याल ज्यादा रिलीजियस सेशन हो गया है.
Thank you, Dr. Iqbal. I think that was very nice. ये कह रहे थे कि hopefully we answered all the questions. I'm sure there are a lot of other questions which generated. Hopefully we can answer that afterwards. ये याद रखें कि हम आहिस्ता आहिस्ता हम खुद भी एक्सपर्ट हो गए, और डॉक्टर इकबाल तो बड़े सीनियर और बड़े सीजन किस्म के वो हैं. तो उन्होंने जो अपना ये नुक्ता नजर पेश किया है जो रिलीजन वाला है, इतना अच्छा मुझे लगा है कि इसके अंदर सारी एस्पेक्ट कवर हो जाती हैं. और मेरे ख्याल में आप आज से शुरू कर दें, एक बड़ा अच्छा एक आर्टिकल इस पे लिख सकते हैं रिलीजन, और मेरे ख्याल में हम आपके साथ होंगे डॉक्टर मुमताज और मैं. और ये आपने मैंने छोड़ना नहीं आपको, ये इसको पेन करें ताकि इसका फायदा आइंदा के लिए भी होगा.
पब्लिश करवाएंगे.
Thank you very much, Dr. Iqbal and Dr. Mumtaz, and everyone actually for being here today, because Eid is around the corner. Hopefully we gave a very positive messages. तो जो इसमें वो है ना, प्लीज अपनी सेफ्टी का ख्याल रखें, कुर्बानी जरूर करें, ईद जरूर मनाएं, लोगों से आप ग्रीट जरूर करें, लेकिन जो आपके बेसिक चीजें उसको मद्देनजर रखें ताकि आप लोग सेफ रहें और एक सेकंड वेव से हम बच सकें, क्योंकि देखें पिछली ईद पे यही हुआ था और हम ये दोहराना नहीं चाह रहे. प्लीज हम सब की तरफ से ईद मुबारक. Hopefully we will have a webinar 2 weeks from now so that you can enjoy your Eid. कुर्बानी करें, सेफ रहें और सब लोगों का ख्याल करें. खुदा हाफिज, अल्लाह हाफिज.